Thanks for choosing us this hour. Let's settle for the details of our stories. Patients across the country continue to feel the impact of the nationwide strike by the Ghana Registered Nurses and Midwives Association. The industrial action has severely disrupted services at outpatient departments in major health facilities, leaving many patients stranded and frustrated. During a tour of selected hospitals in the capital, Health Minister Kwabena Kando assured nurses and midwives that government is taking steps to address their concerns. Channel One News' Jude Duncan reports.
The strike by the Ghana Registered Nurses and Midwives Association stems from delays in implementing the 2024 collective agreement. Key components of the agreement include a 30-month salary, fuel and medical allowances, and government-sponsored renewal of their professional licenses. Health Minister Kwabena Akando is appealing to the Ghana Registered Nurses and Midwives Association to suspend the strike and return to the negotiation table. He toured the Kolebu Teaching Hospital, the Ridge Hospital, and the Lekma Hospital in Accra to assess the extent of the disruption.
Our brothers and sisters, nurses, should listen to the plea of the ordinary Ghanaians and listen to the plea of all of us to come back to work to save lives. Whatever it is, we can assure them that when we sit around the table, we'll find solutions to those challenges. I am in constant touch with the Ministry of Finance, with my colleague minister responsible for finance, Honorable Atofosin, and we cannot sit around the table alone and find solutions. Everybody must be part.
In the eastern region, patients referred to the Koforidua Central Hospital were forced to leave as the few available doctors struggled with the tripled workload. In New Drabin South, 815 Ghana Registered Nurses and Midwife Association members joined the nationwide strike. Abraham Archie is the municipal secretary of the association.
Currently, if you visit the triage and then the OPDs, you can only find our doctors over there. I don't know the other category of health workers who are helping them, but currently what I know is the doctors who are manning those various units. We will only consider coming back if our conditions of service is implemented. We are not seeking for any renegotiation. Why am I saying so? The conditions of service has been signed and sealed. So no need for renegotiation. It will expire next year. So if the current government actually is interested in any kind of renegotiation, they should implement what we have now. Then the following year, we can have a better renegotiation.
In the Bunu and Afro regions, the association regional president Kingsley Osei Safo is encouraging members to stay firm and united.
The withdrawal of services by the GRNMA, that is a group of nurses and midwives, for the roadmap of the strike that we have declared. Today is the second day for the withdrawal of OPD-based services that include antenatal, postnatal, eye clinic, ENT, mental health, all units that run OPD-based services where patients walk in a day, take management, healthcare management, and go back. Today is the second day. We have observed from all the areas within the Bono East and Ahafo regions that members of the GRNMA are actually complying with the directives our leaders put across. That is clearly stated in our the roadmap. We have picked some few signals where nurse managers and heads of nursing in some facilities are trying to coerce members and sometimes some of the rotation nurses and newly posted nurses to be at post. We want to use this to call on our nurse managers and heads of nurses that these people are under the GRNMA and the GRNMA have declared a strike. They should allow our members to go by the directives we have declared.
The situation is equally dire at the Chiriponi district of the Northeast region, where healthcare delivery has been heavily affected. The secretary of the Nurses Association at the Chiriponi District Hospital spoke to Channel One News.
We expected that before the second and third will end, the government will respond to us, but they didn't do. So we have proceeded as at yesterday to implement the second phase of the roadmap, which includes the withdrawal of OPD, emergency, and special clinic services. So as you can see at the moment, our emergency ward is empty. The staff have packed up everything and left the place as at yesterday. And similarly, the OPD is empty. The ANC, the postnatal, and then the specialized clinics are all empty. Fortunately for us here, all our specialized clinics are run by nurses. These are the specialist nurses who run those units, and they've all stopped work as at yesterday. So we are not interested in going on strike. All we want is the implementation of our conditions of service.